I was sort of at a place 10 years ago where I was able to move beyond my mental health challenges, but I didn't have any meaning for my life. So I was just merely existing and trying to get through the day. What I'm doing today is I'm hoping that not only am I making a difference in the lives of other people, but as I interact and start to relate with other people, they're making a difference in my life as well. So I'm really feeling connected to society, and I'm really feeling that I'm contributing my part to my community.
Human Service Training Days is a tradition in Franklin County, and the 2 days is really a retreat for people who spend a whole year helping other people. And the idea is to get into a nice setting. Rhodes Grove is a perfect setting to get away from the normal hustle and bustle. It also allows people to talk to their colleagues, to learn from each other, and to look at things a little differently and reinvigorate them into why they do what they do.
Probably 20 years ago, I was not doing as well. I was in an institutional-based setting, and the only thing I wanted to do was get out of the mental health system. So if you would have said, no, one day you're probably going to work in mental health, I would have said, get out of my face, no way.
Since getting a full-time career job, I have been able to get off of Social Security disability benefits, having been on it for 17 and a half years. Have my own 2-bedroom townhouse that has nothing to do with the mental health system. I hold the keys. I can go in and out, and other people have to knock. Very different from a state hospital setting. Yeah, you can clap that too. And since the year 2006, I haven't been hospitalized once. But I truly believe that those of us with mental health challenges want the same thing that many of you want. We want a home, a job, a date on the weekend, transportation to go places, and to live a long, healthy life. But there are barriers. There are barriers to living in an inclusive neighborhood. Take a look at NIMBY, not in my backyard. There are barriers to meaningful work, with stigma that rides very close to discrimination. There are barriers to maintaining intimate relationships, transportation, and even life itself. 52% of us that have completed the 10-day, 75-hour certification training to become a peer support specialist and gotten a job, not necessarily a certified peer specialist job, and gotten a job where we are using our new skills. 52% of us have been able to reduce or get off our Social Security disability benefits, and you can clap at that as well. Work works for me and many other people. We have to start seeing people in the fullness of their abilities. And they ask children, hey, besides the next greatest toy, iPad, Wii, bicycle, what do you want out of life? And this is what children said. They said they wanted to count. They wanted to know they mattered. They wanted to connect. They wanted to have family and friends. They wanted to contribute. They wanted to have something to give back to other people. And they wanted to be seen as capable, as having a special, unique gift or talent. Besides our next greatest toys, and they cost a lot more, boat, car, home, don't we want the same thing? We want to count, we want to connect, we want to contribute, and we want to be seen as capable. You know, I don't want to die at the age of 60. I want to live to be 100 years old. And I am willing to take personal responsibility for my own health. But I might need a little bit of help from my family, my friends, and my neighbors. It is a beautiful day in the neighborhood. It's a beautiful day for a neighbor. Won't you be mine? Thank you.